So we're joined all the way from Columbus, Ohio, by my friend, Dr. Latonya Carroll, nurse practitioner, just has an unbelievable resume in nursing and healthcare. We got a room full here with us at Velma Jackson High School, and we are in the Health Science Career Cluster. And we're recording this for all of our friends in Madison County Schools, Rosa Scott, Madison Central, Ridgeland High School, Germantown High School, my good friend Mary Slaughter over there in the Health Science class at our Madison Career and Technical Center, our Academic Options Center, and our YouTube channel. So thank you for joining us again, all the way
Thank you.
from the Buckeye State.
Yeah, thank you.
All right, so I know you are a nurse practitioner, and we have several young people interested in the health science field, but it's not just something you jump into, and you actually have kind of a different path into it. I know you went to Central State University, which is a great HBCU up there in Ohio, and you didn't immediately get into nursing. So take us on that little path on how you got into the field you're in.
So initially I planned on going to medical school, but at the time I had a son in the 10th grade, so medical school wasn't quite an option right then. So once I graduated from Central State, I started teaching. And with that science background, I taught ninth grade science and did that for a few years. And then I said, hey, I think I want to go back into medical, because my senior year in high school, I did the clinical laboratory technician program. So I was certified as a phlebotomist coming out of high school. So I had that, healthcare background. But, after teaching for a while, I wanted to get back into into the medical arena. So I went into nursing.
That's awesome. And I'm glad you mentioned phlebotomist, because I did want to talk about all the different jobs. But I think it's important to know that we have and obviously there was a time when pretty much everybody's mom was one or three jobs, and nurse was part of that. So a lot of
Right.
people, because their grandmother was a nurse, their mother was a nurse, they just think they can jump right into it. It's easy money, but becoming a nurse is extremely difficult. Now,
Yep.
it's obvious nursing jobs are not going away. They'll always be in demand, and we
Right.
need more and more people to get into it. But I think it's extremely important to be realistic of the
Right.
expectations someone would have in nursing school. So take us through a little bit on what it would take to become a nurse. And I know every state is different, but the general curriculum is going to be the same everywhere.
So you have a couple different paths. You can do a 2-year program as a registered nurse and associate program, or you can do a 4-year program, BSN. If you want to take the LPM route, some of those programs are 2 years, some of them are 1 year. I actually, because I had already had a bachelor's degree, I did an accelerated program that was 15 months. And
Wow.
so at the completion of that, instead of me earning a BSN, I got an MSN. So I earned my master's degree as part of my initial registered nursing program.
Now, and I think that's great, because there are multiple entries into nursing, but I think it's important for people to understand when you start training to become a nurse, or when you're doing your clinicals, you are going to have to see things that maybe aren't pleasant. You're going to have to deal with bodily fluids. You're going to have to
Yep.
deal with smells. You're going to have to deal with gruesome injuries. You're going to have to
Right.
deal with people that are extremely scared. And unfortunately, sometimes you see people that pass away. So, like we
Right.
said, it is a great field to get into, but it's also, you got to be mentally prepared for that. And I think I've seen kids that have started the nursing program, and then they didn't realize what they were getting into, and then they kind of back up and start over.
Right. I guess for me, I had a little more life experience, so it was a little bit different for me. So I was able to kind of understand different aspects of things. I had seen people, not doing well, and, having, multiple conditions that they had to have treated. So for me, and I had also worked as a patient care assistant prior to going to nursing school. So that gave me a little more background to being hands-on with patients prior to
Yep.
going into nursing. So that's also something that, I think a lot of students should try and do, is try and do that nurse assistant or patient care assistant prior to going to nursing, so you can kind of see the different things that you will see. And so you can say, yeah, I want to do this, or no, this is not quite it. Because even though you don't get the full experience of being a nurse, but you get to see some of the things that they will see most of the time in those settings.
Absolutely. And that's the cool thing about the medical field is you can get your foot in the door and work your way up while you're working. A good
Right,
friend of mine, he was a ER nurse for years here in Jackson, and he used that experience to make him more prepared for med school. And now he's a doctor in Pittsburgh. And he told me out of his own mouth, because I was a nurse, I had all that medical experience. Med school was a breeze for me. Now it was time
right,
consuming. But he knew so much about patient care. He had worked close with
right,
doctors, and because of that, it made him a good doctor. And that's the same with nursing. And I'm glad you mentioned CNA, because we need good CNAs.
right.
That's something that's not going away. But when you're 18 years old and you can get a CNA certification program, start working with patients, see how nurses work, you can work as a CNA and go to nursing school while you're working full time in a hospital.
And some of those hospitals have programs where they will pay for you to go to nursing school after, so many years of service once you finish. So that's also, a good thing with those type of jobs. You can get your schooling paid for and not have to worry about owing any money when you get finished. You just have to pay, do maybe some service when you get finished, 2 to 3 years after you finish your program, work for that facility that paid for you to go to school.
Absolutely. Now, I know you mentioned you were certified as a phlebotomist.
Mhm.
Obviously, nurse and doctor are the ones all people always hear in the health field, but there are so many great careers that have to be there for hospitals, clinics, any type of healthcare facility to be successful. So
Right.
maybe somebody is like, I'm interested in the health field, but I don't know if I would do too well with blood and broken bones or things like that. What are some of these other careers that are great that are in the healthcare field that may not require, some do, some don't, the same amount of training and different areas of expertise?
Some of those are, you can do a respiratory therapist. I mean, you'll do all the breathing treatments and, maybe hook up ventilators. And some of them even do extra certification and they hook up ECMO, which is you know, kind of like a bypass system outside of the OR. And then you have also people that do the radiology. They come in the radiology techs, they come and do all our x-rays. They either do them at the bedside or they might be in the ER and have patients come in and do that. So it's quite a few different areas. You have audiologists if you don't want to work with, and you just want to do hearing, you do audiology. You might want to work with patients who have speech impediments and you do speech pathology. So there's a lot of different areas that you can work in that don't necessarily have anything to do with blood and death and dying, but has aspects of patient care, but in different settings.
Yeah, and also there's a huge need for technology people in the medical field now with
Right.
all these new ways to diagnose, all these new instruments, health informatics, and then health tech people, health IT people have never been needed more than they are now.
Yeah, they're doing a lot of programs where you can do informatics, certification when you do your nursing program or nurse practitioner programs. You can do it in that area, or if you don't want to do healthcare at all, they do have master's programs where you can do health informatics because we are doing more, technology with our healthcare. Especially with remote patient monitoring, where patients just hook up a machine and it just automatically transmit results to the provider without them having to go into the office. So
Absolutely.
that's been developing a lot. So, there's a lot of areas that you can work and not necessarily patient care, but it is patient care because you're preparing the providers to get that care so they can do a lot of things remotely. And we saw that a lot with the pandemic.
Yeah, and absolutely, and you mentioned respiratory therapists. I think respiratory therapists were finally appreciated the way they should have been during COVID, because that was
Right,
one of the most important jobs on the planet during that
pretty much.
time. And also, and another one, and we've had some students from Velma Jackson go the pharmacy route.
Right.
They're getting their they did the undergrad and now they're doing the pharmacy school. You got to have people to mix those IV bags. You got to have people
Yeah.
to make sure the medications are distributed correctly. And a lot of them never see a patient, but they're down
Nope.
in the pharmacy room having a very, very important job when it comes to patient care. And also a big thing now in Mississippi is the medical research. We have
Right.
state of the art lab people that, I think that stuff is gross, but it's needed when people are giving
Right.
blood samples, any type of bodily fluid sample, you have
Right.
to have lab people to analyze that.
Right. And one of the other big areas is the blood bank. When you got to collect that blood in the hospital, they have to make sure they type and screen the patients, make sure the blood is appropriate for that patient, and that's a huge area in the hospital as well. And they don't do a lot of patient care, but they have an important aspect, because if that blood isn't typed and screened correctly, you can give a patient a reaction to blood that they're not compatible with.
Absolutely. Now I do want to talk about a little bit what you do, because I think it's pretty cool. You do the telehealth. You
Yeah.
have a lot of virtual patients, and you deal with weight loss, you deal with addiction, you deal with substance abuse. So, talk about the way your business operates, because on top of all this, you're an entrepreneur, which is super cool as well. So you can become a healthcare entrepreneur like yourself. So, talk about a little bit about your company and what all you do as far as helping patients.
So right now I do I have I just gained another license since last time we spoke. I now have 18 state licenses. I just added Louisiana.
Wow.
So I'm able to see patients in all those states, all the different states that I'm licensed in. And, I never have to leave my seat. I treat patients for the addiction, weight loss, some primary care. You can do some primary care kind of um, physical exams, limited on telehealth, but for the most part, I do a lot of the addiction and mental health, because I actually got that extra certification for mental health right at the beginning of the pandemic. I completed that program on May 2020 for the psych mental health nurse practitioner. So I have the 3 certifications for family, pediatrics, and psychiatric nurse practitioner.
Wow, that's incredible. 18 states, that's almost half the country. Now one thing I always like seeing the mix of is, even if we have kids that have no desire to ever be in the health field, you are an entrepreneur, and we have several kids that say they want to be an entrepreneur. But I think there's a learning curve that I don't think that social media really shows, because everybody sees the glamorous side on the Instagram posts. But we have another guest of this class that's a pediatric GI doctor here in Jackson, and she said, I learned everything I could ever learn about how to take care of a patient, but I learned nothing how to run a business. And she said her learning curve was like somebody right out of kindergarten, having to learn
And
all the ins and outs of running a business.
and that's pretty much how I had to learn. And it was more so kind of self-taught, looking up information. I would see somebody, do something, and that's how I ended up with the telehealth in the beginning. I had friends that would say, can you prescribe me this? I'm like, no, I need to get paid for this. And that's how I started out. And I started out seeing how it was, I could see patients by video. But as far as the business aspect, I had to, learn, okay, well, you need to have an LLC or whatever, you need as far as the medical business format in the state that you're in Ohio, it's the LLC. And then you have to get an EIN, which is the social security number for your business. And then from there, in order for me to get insurance, I had to make sure if I wanted to accept Medicare, Medicaid, I had to have those things put in place. And then in order to get paid as a business, as far as healthcare, you have to have, an NPI, which is your personal one. NPI 1 is for your personal, but you need an NPI 2, because most insurance company won't pay you directly. They pay your business. So I had to learn about all of those different steps, kind of trial and error on my own, kind of looking it up, because, that's something I wanted to do. So it was like, okay, I get a rejection. Okay, now I got to research what I need to do for the next step to get this business set up. So right now I'm able to accept probably about 8 to 10 different insurances
Wow.
while I'm seeing patients in those different states.
Yeah, and I would suggest to anybody, whatever field you're going into, take an entrepreneurship class in
Yeah,
community college or
definitely.
college to really at least get some practice. Now, before I get to the students' questions, I know something you're very passionate about is getting more men into the nursing field. Now,
Yeah,
we always, we've had several guests from all these fields, and we want to make them diverse, but it's usually we got to get women in this field. But
right,
every female nurse that I talk to says, look, we can never have enough guys on the floor. So talk
right.
about why there's such a need for men in the nursing field.
One of the biggest things is a lot of patients, they want to look and see people who look like them. And most of the men, they don't very often see people who look like them as far as males because there's not very many. And, we definitely need more males. It's probably about, when I looked last, maybe 1 to 2% male, and that's of all races that was in the field of nursing. And, definitely need more because you want to have that, variety of different experiences and, different providers to kind of take care of you because you want to see people you look like, and most men don't see those people they look like as their nurses.
Yeah, and I've had nurses tell me it could be as simple as in an emergency situation, somebody that's tall enough to reach something, somebody
Right.
that's strong enough to move somebody.
Yeah.
And just for a female's mental security when if there's a potential dangerous situation, women are for the most part are going to feel safer when there's a male there. I have a friend
Right.
who's a male nurse here in Jackson, and he gets job offers every day because he
Yeah.
was like, and he's like, look, he goes, look, I'm an okay nurse, but they need men to step into these roles uh, for for patient care and just for safety issues.
And then there's some patients that may prefer a male over a female nurse. Not necessarily a male preferring a male nurse. There are some females that prefer a male nurse, themselves. So you want to make sure you have that different nurses, genders, and everything to take care of patients because you know you want to have a preference and not just be forced to have just one option of people that can take care of you. And, most of the guys that I worked with, I had a couple of guys I worked with as a nurse when I was working in Children's Hospital. It was kind of funny because he was like military, kind of stern and direct, no facial features, but he was really good working with the babies. So you get that, and but you can't get it if you don't have that those different providers working.
Yeah, and I couldn't agree with you more. There really is a need for men to get into the nursing field. Obviously, we see them
Right,
and as doctors and there's a lot of therapists and things like that, but there is a place for men in the nursing
right,
field, and
definitely,
I stand by that, and I will tell anybody that. So, really hope everybody, especially our group over there in our health science at MCTC, the young men at least consider getting into the nursing because they are definitely needed. So I'm gonna get to
definitely.
many of these questions. And I love this first one. This is Precious Blackman. She's in ninth grade, one of our basketball players here at Velma Jackson.
Okay.
And she has two questions. The first one is, how do you deal with seeing all the blood and bones when you're a nurse? And how do you cope with people telling you about their personal problems?
The blood and all of that never really bothered me because I was kind of almost like kind of adrenaline kind of junkie. My first job was working in the recovery room. So when patients would come out of the surgery, and it was kind of like a holdover for ICU, so we would see, some patients, their belly might have been left open from surgery and they're sedated, so they might have to go back. So things like that didn't bother me. I kind of welcomed kind of that. I wanted the harder patients because you kind of learned more. Um, and then what was the second question?
How do you cope with people telling you about their personal problems?
I don't know. I think people are kind of drawn to me before I was a nursing. People would just come up to me and start talking to me about different things. I think sometimes you just have that calm demeanor and people are open to telling you things, especially if you just sit there and listen. And I had that happen to me prior to going into nursing. I was at a restaurant and some guy just start talking to me and telling me about his problems, and it's like it's basically your demeanor and people being open to telling you, about their issues. And you just have to be kind of open and not judgmental. And I try not to judge people no matter what it is when they tell me things.
Absolutely. Now, Uh, I like this one. This is Derek Mitchell. He's also in ninth grade, and
Okay.
he has two questions as well. He said, "How many years did it take you to reach the level you are, and was your stomach ever weak handling crazy smells?"
I'm gonna answer the second one first and then I'll answer the first one. So the second one, the only thing that I absolutely just did not like to do when I worked in the ICU was cleaning the tracheotomies. I would always trade a nurse and get them to do that. I just couldn't do that one. I would clean up, any other body fluid, but I just couldn't do the trach. when they had the hole in their throat. So that was the only thing I couldn't do. That suctioning sound and all that I couldn't do. So so for me to get where I was at this point, I did 4 years undergraduate, and then I did 15 months for the registered nursing program, and then my program for my nurse practitioner program. It was a year and a half program, but because I did the two certifications at the same time, it took me 2 years. I did my pediatrics and my family programs both together. And then I, went back and then did the mental health, but part of that extra time. So it was like maybe about a 3-4 year period. And I got the credits to finish the doctorate as well. So I started my nurse practitioner program 2009, and by 2015, I had the two certifications plus the doctorate degree.
And that was while you were still working full time. So that's real. That's really cool.
Yeah.
This is Caden Williams, a part of our state championship powerlifting team, which won the state championship this weekend here in Mississippi.
Oh, congratulations.
Did any time in your career, did it get hard and you want to change specialties?
No, I didn't want to ever change specialties. I wanted to add on. And it was more so like I added the mental health certification because I was working with patients who had mental health concerns, but I didn't have that knowledge to kind of treat them without asking someone else their opinion or getting their suggestion on what medications to use. So I went back and got that extra education for myself because I mean, honestly, I don't like people telling me what to do. So I wanted to get the information so I could do it myself.
Hey, that's a great reason to be an entrepreneur. I just got two more. This is Rondell Ellis. He's in 9th grade, and he asked, "What are some new technologies you've seen develop during your career as a nurse?"
A lot of the remote patient monitoring, where patients are, streaming their glucose readings and blood pressure readings, and all of that through the system, and they don't have to necessarily do write it down on paper every day. They have a machine and it transmits it directly to their provider, and they don't have to go to they don't have to go weekly to their appointment where they had to get a weekly weigh-in or blood sugars or anything like that. It's automatically transmitted. So that's some of the cool things that I've seen, because a lot of people, especially with the pandemic, they couldn't move around. And so that kind of picked up a lot of things that we were able to do remotely.
Absolutely. It's got one more. This is Mariah LaFleur, one of our volleyball players here. She's a junior. And she asked, "What part of your career has been the most difficult?"
Mostly it's probably when I'm not in a education program, because I'm always trying to learn something different. So I usually try to figure out, like, what am I going to do next when I'm not in school, or, so that's where I'm at right now. Like, what am I going to do next? Because there's always something more to learn. I never profess to know everything, because I can always learn from everyone. So I always try and see, what can I learn next? So right now I'm doing a lot of work with inpatient addiction as well. So still do the remote telehealth, but I'm doing work with inpatient residential addiction as well.
Yeah, and that's the thing, is that with these technological advances, there's going to be more and more need for health professionals, whether they're on the lab side, the tech side, or the patient care side. Right. This is a field that is not going away and is only going to grow. So we really need good people to get into this and develop those skills. But we're almost out of time, and we thank you so much for joining us again. I know your schedule is crazy, but why should these kids, no matter who they are, really consider getting into this field that can be so rewarding?
I think it's because, we need people, especially, one of the biggest things that we've noticed in the last few years with the population that's, being treated, a lot of patients want people that look like them. As far as nursing, when I did some research on it, 80% of the nurses were white females. So we want to get, people of all races, genders, everybody should have somebody that they can relate to in the healthcare field. And, with this population is changing, we need to get more. We need to get more. It shouldn't be 80% of one particular race that's working in healthcare, because those patients, they can't relate to it. So, we want to have a little mixture of everything so patients can, kind of relate and say, oh, there's a, Spanish speaking doctor I can speak to if that's their case, or if somebody that's, from, the islands, they speak Creole or, French or, anything like that. We want to have a different, expansive, provider, listing so patients can see that.
Yeah, and real quick, I know we got to go, but I think it's extremely important. Being bilingual in this field can be invaluable, and you can pretty
Definitely.
much demand a higher
Pretty
rate.
much.
And even my sister, who's learned ASL
Mhm.
as a second language, just very, very invaluable to be able to communicate with any type of patient. So I'm glad you did mention that, because
Yeah,
we have some first generation Americans in our school district that speak multiple languages, and I think this would
right.
be a great field for them as well.
Oh, definitely, because otherwise we have to call on the phone to a language line to get an interpreter to do our interpreting for us, versus having someone that can have that firsthand one-on-one contact with that patient without a third person kind of translating things for them.
Absolutely. Well, again, we thank you so much for joining us today, Dr. Latonya Carroll, all the way from Columbus, Ohio. We thank you so much for taking some time for us.
Thanks.
All
Take
right, talk
care.
to you soon, buddy.